John Whelan.
Much, Cathaoirleach. And most days you would come into work here, you would be glad to be Irish and be proud to be Irish, but unfortunately yesterday was not one of those days. It was a day that was punctuated by the Magdalene's report and was an indictment on us all, not just politics and politicians and governments, but on society in general. It goes to show how it's not always, I think we should not always run with the conventional wisdom of the day or the herd mentality about what is right and what is best for people. And it does underscore for us here as senators the importance of standing up and speaking out at the time and not retrospectively. The Magdalene's report on the Magdalene Laundries is a sordid and shameful chapter in Irish history, and the hurt and harm and horror that was inflicted upon these women is an indictment of us all. And I do think we should not add insult to injury now by in any way, if you like, equivocating. I would like to second the call by Labour youth and Labour women that the government and the state should unreservedly apologise to these women. I know that the Taoiseach himself is a kind, a caring and compassionate man, and I think that whoever is advising him that it would be unwise to apologise is not correct. I think he should go with his heart on this one, and I think the people of the country would be thankful to him if he were to apologise to the Magdalene women on behalf of the state. Cathaoirleach, we're 2 years on in terms of this government, and it's 2 years since we promised both Labour and Fine Gael to radically reform our health services. And I think we have made maybe 2 steps forward and 3 steps back, because we still have, unfortunately, a 2-tier system where the people who get the best care and first care are those who can pay the most. But we see recently again with the hike in VHI fees, more and more people are dropping out of the private system and putting pressure and a further burden on the public system and leading to longer queues and longer delays. I'm not surprised. I don't know how the system works at all. I have reports from a constituent whereby they got a folio into their door from the VHI saying that an ambulance that brought a woman from the Midlands to a hospital in Dublin cost €1,900. No system could sustain that, Cathaoirleach. And I'd like the leader to facilitate the Minister for Health, who's a thankless task, to come in here to the House and set out his vision and strategy for what way are the reforms going. Because Senator Eamon Coughlin raised a very interesting point yesterday. There's money being stripped away for productive, and hospitals are doing a good job, and apparently hospitals that are not as effective and as not as productive are being rewarded. I would ask you to bear with me, Cathaoirleach, because we have been promised radical reforms in terms of the appointment of multidisciplinary teams. It hasn't happened, and 18 months on now, I'm still waiting here for the Minister to make an announcement in terms of community nursing homes, in particular in relation to hospitals like Abbeyleix and Shane Hospital. People need to know where they stand, and I do think it would be a welcome if the Minister for Health came in, set out his stall and told us what progress has been made and what is the roadmap and time frame for the other reforms. Thanks.